Hi, my name is Esther Goldstein, and I'm really excited that you're on here. If you're here, it's because you've been a therapist either for a little bit of time or for quite some time. And although you know you've been making like a really big difference in your clients' lives, there's this nagging feeling inside of you. There's this nagging feeling like you need more. You're not quite sure what it is because you know that there are a lot of advanced trauma therapy methods out there, and you don't want to just jump into any one, but you want to be mindful in your choice about the next training you take. This trauma informed care training is meant to be that training for you. In this training, we teach you all about the concept of what does it mean to be a trauma therapist? What does it mean? What's the bedrock? What's the framework of really good trauma care, right? There's a lot of advanced trauma skills, but in order to be able to administer really well informed, balanced, integrated, science-based interventions, you want to have a really good framework of what does it mean to be a trauma therapist. So this training is for you if you're committed to, at the end of the day, closing your casebook, packing away the office and heading into bed, feeling just at peace and knowing that you are aligned with your professional integrity and feeling wholesome in your personal identity as well. In this course, we are going to be reviewing the definitions of trauma, the primary kinds of trauma, the history of trauma treatment, the making of a trauma therapist. What does it mean to be a trauma therapist? As well, we go through different popular assessments, science-based assessments that incorporates, trauma symptoms, trauma diagnoses, as well as attachment, shame, and self-care patterns we look at, as well as dissociative symptoms. We provide you 4 interventions for each phase of the trauma work model. We go through a 4-phase trauma model, and we provide interventions. I'm just going to go through some of the bullet points for the course outline. You probably have it in front of you right now. But very simply, the first part is we talk about what's the difference between a trauma specialist and a trauma-informed therapist. We go through that in detail. History of trauma therapy as a specialty, the 4-phase trauma model, why use a 4-phase trauma model, right? We explain it in detail. And then we talk about the 4-phase trauma model explained. So we're really giving you a robust understanding of what a trauma model is, what the difference is between, a trauma specialist and a trauma-informed therapist. And we talk to you about the history. It's important for you to have this knowledge because it really helps anchor you in your wisdom when you are on the phone with that client, when you're sitting in treatment with that client, when you are offering interventions. All of this knowledge is almost like this deep thread of knowledge and wisdom and confidence that makes a difference in your work, okay? Then we talk about what's a trauma-informed psychotherapist, the basic principles of trauma-informed care, okay? We go through details. The making of a trauma therapist. So we go through like knowing your why, doing your work, right, your own work, expecting hiccups and how to deal with them, like hiccups along the way for yourself, for your clients. We talk about therapy for the therapist, and we talk about supervision and peer support. Okay, so we go through that in detail. The next part we talk about is how modern trauma research has shifted the way we view behavior and mental illness. Okay, so we talk about, the past and then the present, like the recent knowledge and data that's impacting our care. Okay, so we talk about destigmatizing the word trauma and how it impacts your client's daily life. The anatomy of the brain and the body experience. So this part I love because we have like awesome visuals that we've created. I've worked with a media specialist to create images to describe how like stress impacts the body, trauma, different attachment interventions, as well as attachment and neglect trauma, betrayal trauma, as well as shock trauma. So you see those images, but you also see the images of what healing allows for. And you could use those images as psychoeducational interventions for your clients, okay? Different types of trauma. So we talk about the 3 different kinds of trauma: the acute trauma, the big T trauma, the chronic trauma, okay, the small t trauma, and complex trauma. Okay, then we go through important definitions, so trauma and stress, traumatic events, traumatic response, and grief. And there's a lot of other terms that we go into. I'm just giving you a broad overview. Okay, so part 3, recognizing the different kinds of trauma. So we talk about like stress and shock trauma. So we talk about post-traumatic stress, acute stress disorder, post-traumatic stress disorder, complex post-traumatic stress disorder, and chronic stress. Okay, but we go through it in detail. And part of this training is that we really give you that like 6th sense to be able to pick up on symptoms that your clients are holding that might not come out on a diagnostic code or on an assessment, but you pick up on it based on the body language, based on the narrative that they're sharing with you, based on some of their behavioral impulses, based on some of their relational dynamics. So we teach you all about developing that sixth sense of how do you have more robust and comprehensive and more multifaceted approach to assessing clients and then treating clients. And also knowing how to use yourself, because knowing how to use yourself is huge in this work. Okay, then we talk about other forms of trauma like transgenerational trauma and vicarious trauma. Okay, then we talk about other factors that impact trauma. So we talk about attachment. Okay, so the attachment interviews and assessments, dissociative-based traumas. We talk about dissociative traumas, the different kinds of dissociation, how we assess for it, right? So early childhood dissociative trauma, and then we talk about structural dissociation. We talk about primary, secondary, and tertiary, and we go through it in detail, okay? We talk about shame and grief, how you work with that. Okay, part 3 is responses to trauma, okay? So we have like a whole section with a chart of people's responses to trauma, okay? Then we go through important terms and definitions. So what's a trauma response and what are triggers? And, we have visuals as well. So when you're learning this course, we want it to be easily digestible to you while it's also expanding your knowledge and skill set. And the reason we're doing that is because we want you to then be able to provide that process to your clients, right? You're providing a very easy to digest concept, but it's still broadening their knowledge, psychoeducation, and you're pushing them towards like the next level healing, wherever they're at. And we'll talk about that. Okay, then we go through the biological and emotional responses. So we talk about neurotransmission and neuroplasticity, the somatic memory, so like the cellular and procedural memory. I go through this in images in detail. We talk about the autonomic, the limbic system, right? So kind of how the body regulates emotions and input. So we talk about the emergency response, learned motor actions, and attraction or repulsion. So just understanding the way that the body responds to triggers, stimuli, and different responses it goes to. And then knowing which response your client is having either in session or in their life. Okay, cognitive responses, we talk about, physical traumas, like surgeries, accidents, health issues, and chronic pain. And we talk about behavioral and existential questions that come up, but also responses to trauma. Okay, then we provide assessments. So we give you the overview of trauma-informed screening and assessment tools. We teach you and we provide some images and some downloads for you to use as well, the importance of reading body language. So you'll see images of like body posture and helping you get the body-based belief from the client. A client could say, I'm okay. I don't know what's going on. Like, I'm okay. I want friends, or I want my husband or all my kids to feel comfortable with me. And we'll teach you, like, based on the body posture, the energy that you're sensing, okay, that we're going to teach you how to do that. What else might be going on that the client's not aware of, but that it's your job to call out, right? And so we'll talk about how you do that, how you personally pick up on it, and then how you use an intervention to target that as the treatment goal, because they're not aware of this unconscious communication or this belief that they're holding that's clearly coming up and blocking them in life. We talk about more creative ways to assess family history, socioeconomic status, environmental factors, health history, and other factors to avoid re-traumatization. So sometimes a generic assessment is traumatizing, so we teach you like a creative way to administer assessments or to get the data in a way that's gentle for clients. And we talk about ongoing reassessments at each phase, okay? Then we have an intervention phase, so practical interventions within each phase of the treatment. We talk about ongoing assessments that have to be done to establish the best method to provide desired outcomes. And we talk about outcomes because all of this is about providing better clinical outcomes, okay? So although like trauma therapy is a creative way that we do work and a little bit of flexibility, we're very closely connected to this concept of allowing for clinical outcomes and making a shift, because that's why clients are in our offices, to make shifts, right? And we'll talk about how do you track shifts, how do you set realistic expectations, and how do you define clinical outcomes, okay? So we set you as the therapist and your client as the client. We set you up for success, okay, not for failure. And how do you work with setbacks, which are expected, right? So we go through stabilization, safety, and engagement, okay? We talk all about developing a working relationship, establishing a client's sense of self, discovering relational capacity, psychoeducation, understanding the impacts of trauma, managing overwhelming thoughts, emotions, and memories, and intrusions, and getting to know triggers, ineffective and maladaptive coping strategies, and somatic reactions while developing new supportive tools. The next part is processing memories. So we talk about getting to know the self, reorganization, and meaning making. So we provide you many tools of cognitively and emotionally processing trauma-related experiences, the view of the self in the present, the concept of meaning making, which we'll talk about. What does meaning making mean in the past, in the present? What does it mean for the future self of the client? Right? Sometimes there's a trauma self, but then we want to develop like a self, right, who experienced trauma but is much wider than just the trauma self. Exploring concerns of shame and guilt, grief and self-blame, right? Grief, actual grief, or the fear or the loss of expectations or hope. Supporting the development of the personal narrative and supporting lifestyle and relationship changes and maintenance strategies, okay? And then the other phase is reconnection and integration. We talk about personal and relational integrity and well-being. We talk about all of this is a lot more deep, but I'm giving you an overview. Developing greater emotional intelligence, enhancing connections with self, family, community, addressing concerns of injustice and abuse, supporting the development of more trusting, respectful, and caring relationships, and establishing a new purpose and meaning in life. Okay, we also talk about the challenges that come up that impact client care and what every trauma therapist needs to know. So we talk about self-care. We talk about when a therapist is triggered by the client's trauma. How do you know? What do you do? And how you use it to deepen the work for yourself and for your client, but really to impact your clinical work better instead of avoiding it, okay? So we teach you to be more confident and steady in being able to notice your own inner world. Going too quickly or going too slowly in trauma. So we talk about like how do you know the difference between going too slowly where the client feels hopeless or going too quickly where the client's feeling agitated, and how do you find that balance? We talk about it in detail. We talk about providing a safety net for clients, making sure to treat the base concern. So one of the big things that I love, it's like my pet peeve, is like when I hear someone reach out for therapy or when I hear a therapist and I'm providing consultation, so many times it's so easy for a therapist to get lost in the symptoms or in the struggle. And one of the things I teach you here is like, how do you make sure that you're treating the base concern, right? Like what are your treatment goals? How do you develop them in the beginning of treatment? And how are you making sure that you're tending to the core issue? Because everyone who has a core issue also has symptoms, but you want to be managing the symptoms enough so the person could do processing and function, but you want to be getting to the core of the issue, right? If there's a rotting root, that's where we want to do the healing. That's where the boo-boo is. That's where the trauma is, okay? So how do you make sure that you're really getting to the core of the issue and knowing when to refer out, okay? So we really go through that a lot. We are all about, like, we want your clinical outcomes to be better. We want to help you reshape the way that you see trauma, reshape the way that you fish for trauma, the way that you understand trauma. Clients do better when we have an understanding, even if you're not a trauma therapist. If you have a much more, expansive knowledge base and wisdom about yourself, wisdom about the world, wisdom about, like, the neurobiology of attachment and about trauma, then you're really going to allow this nonverbal communication to your clients, present ones and future ones. That's a sense, like this felt sense, right? The somatic feeling in the room that you got it and you're wise and you can understand them in a much wider and deeper way. So this training is going to give you like an expanded bandwidth of your own knowledge and a wider tolerance and capacity to meet clients where they're at. A lot of the interventions we teach are informed by my trainings in somatic psychotherapy. I'm a sensory motor psychotherapist. I've done a lot of advanced trainings. I'm continuing my training, so you're going to have a lot of somatic interventions, somatic informed work that I teach you, skills that I've learned and that I teach all the therapists I work with that really help shift clients out of stuck points. From assessments to intervention, right? And even psychoeducation could be an intervention, but also intervention in the processing phase. We utilize a lot of attachment-informed therapy, IFS, parts work. We have some free download content about like introducing parts to clients. We have visuals, so it's really relatable. A lot of creative art, and I use a lot of grounding and stabilization from EMDR and other therapy methods, as well as DBT. But it's really, all of the skills that I use are digestible for anyone. So even if you've never done those advanced trainings, or even if you have, it's made to be able to digest it and work with the clients that you're working with. For people who asked, for clients, it doesn't matter what age your clients are. This training is for everyone. So we go through assessments for, children, for adults, for elders. We go through all of those assessments. And it's really, I think the point of this, or what I've seen effective in my trainings for clinicians and consultation, is that the focus is almost like on you. And as you get more steady, and as you get more wise, and as you get more skilled, then that just shifts the whole dynamic. And then, of course, there's interventions. But half of the interventions I teach you, some are the practical and the science-based interventions. The other half, that's also science-based, is like the relational aspect, right? Half of it's the nonverbal, what the client's not saying, but is so much part of the work. So join in. I'm so excited to learn with all of you and to join you in this community of people who are committed to making a change, to shifting your wisdom and your knowledge, to shifting your clients' outcomes in therapy, and to widening the talk about trauma and trauma healing in this world.